In today's video, we will learn about the abducens nerve, including its origin, pathway, functions, and clinical implications. The abducens nerve is named after its primary function, abduction of the eye. The term abducens is derived from the Latin word abducere, which means to lead away or to abduct. This is purely a motor nerve and innervates the lateral rectus muscle of the eye, which abducts the eyeball. Since its primary role is to abduct the eye, it was aptly named the abducens nerve. The abducens nerve originates from the abducens nucleus, located in the pons at the level of the facial colliculus in the floor of the fourth ventricle. The nerve fibers emerge from the brainstem at the pontomedullary junction near the midline. After emerging from the brainstem, the nerve travels anteriorly and superiorly, passing through the subarachnoid space. It then ascends and pierces the dura mater at the Dorillo's canal near the clivus. Dorillo's canal is situated at the apex of the petrous part of the temporal bone in the petroclival region. It is a bony and fibrous channel housing the abducens nerve and the inferior petrosal sinus as they travel towards the cavernous sinus. After passing through the Dorillo's canal, the nerve enters the cavernous sinus where it runs adjacent to the internal carotid artery. Finally, it enters the superior orbital fissure and reaches the lateral rectus muscle of the eye. The primary function of the abducens nerve is motor innervation of the lateral rectus muscle, which is responsible for abduction of the eye, that is moving the eyeball laterally away from the midline, and coordinating smooth eye movements with the oculomotor and trochlear nerves. The abducens nerve may get involved in some clinical conditions affecting brain. The most common dysfunction of abducens nerve is abducens nerve palsy. Damage to the abducens nerve leads to lateral rectus muscle paralysis, causing medial strabismus called esotropia, in which the affected eye is pulled inward due to the unopposed action of the medial rectus muscle. Diplopia or double vision, there is difficulty looking laterally on the affected side. Head turning compensation, as patients may turn their head towards the affected side to minimize diplopia. The picture on the right shows limitation of abduction of the right eye due to the abducens nerve palsy. This individual tries to look to his right, but the right eye fails to turn to the side. Causes of abducens nerve palsy include increased intracranial pressure. Since abducens nerve has a long intracranial course, it is vulnerable to compression due to brain swelling or tumors. Head injuries can damage the nerve, especially near the clivus. Cavernous sinus thrombosis. Since the nerve runs within the cavernous sinus, infections or thrombosis in this area can lead to dysfunction. Brainstem lesions like stroke, multiple sclerosis, or demyelinating diseases affecting the pons can impair abducens nerve function. The image on the right side shows cross-section of cavernous sinus illustrating proximity to the cranial nerves, which is why these nerves may get affected in the cases of cavernous sinus thrombosis, a lethal complication of some maxillofacial infections if not treated properly. To conclude, the abducens nerve or sixth cranial nerve plays a crucial role in the eye movement by innervating the lateral rectus muscle, allowing for abduction of the eye. Originating from the pons, it follows a long intracranial course, making it particularly susceptible to injury from increased intracranial pressure, trauma, or vascular lesions. Dysfunction of this nerve results in lateral rectus palsy, causing medial strabismus and diplopia. Given its clinical significance, assessing the abducens nerve is essential in neurological examinations, especially in conditions affecting the brainstem or cranial nerve pathways. In the next part, we'll continue with the other cranial nerves. Stay tuned. Thank you for watching. Do like and share the video and subscribe the channel to learn more.